Thanks for coming back and joining us with Denise and with Kathy here. Can we go ahead and, for anyone that's watching right now, okay, Kathy gave some really important information, and that is check with your insurance provider, find out if in fact they can come to the Baxter Regional Family Clinic, if they're will be covered under their insurance. So once they've done that and they've called, and we'll give the number again at the end of the program. So they've called, they've made an appointment, and all of a sudden they are experiencing maybe a little bit of congestion in their chest. It's not anything that they need to go to the emergency room for, but it's something that they really will feel better if they come and see Denise, okay? So what are the steps? What do you ask people to do when they come into your clinic? They're coming in with, do you have them bring in their medications?
Absolutely, always. We always encourage our patients to bring all of their medications with them to each visit, so we can see firsthand what kind of changes have occurred since the last visit. What exactly are they on? Because it's very common for somebody to get in the room and all of a sudden there's a pop quiz.
Yeah.
What medications are you taking? And people freeze and they can't remember some of them, or they don't remember the strength or how they're taking it. So if they actually bring in the prescription bottles with them,
right,
it's easier for Denise and the other providers to see what they're taking and deal with it from there.
And I would imagine you run into every once in a while too, maybe a person has seen more than one physician and they've got medications that have been filled at 2 different locations that maybe they shouldn't be taking together.
Correct.
Is that something that you see?
Absolutely.
Yeah. Yeah. I know I've talked to some folks, and especially it seems the older we get, the more forgetful we become at times. I'll put myself in that category as well, saying, I don't know, should I be taking this or not? I better check with a pharmacist and find out if this is safe to take. And I don't know that everybody always thinks of that, those type of things. So that's a big plus. You keep people safe when they come to you, that you go through their medications, make sure what they're taking and if they should be taking them together.
Right.
So kind of thing. And then what else would be done? Did they go through they go through their weight and their height, and you'd be checking, of course, for why they were congested. So do you have x-ray capabilities there?
We do on-site x-rays.
Okay, you can do the on-site, so that means you don't have to go someplace up to the hospital or someplace else to get your x-ray. That's a great thing. What about if you determine that they're going to need a blood draw? So
We do that right in-house. You know, that takes maybe 10 minutes. If
That's
the patient
great.
comes in and if they have the congestion issues, we would, of course, bring them in, height, weight, blood pressure, vital signs, brief history, and a medicine reconciliation, which is just going through their medicines, making sure, yes, they are taking this, no, they're no longer taking that. Of course, we check their allergies, do a brief history, and then I would come in, examine them from head to toe if need be. If we need x-ray, we order it right then, we take them back right then. If lab is necessary, we put the orders in and they do their labs. You know,
that's
right
great. That's great. And then the labs are sent up to the hospital, usually, in most cases.
Some of them are, we do some labs in-house, a few things in-house. Of course, strep screens, flu screens, basic things we do in-house. We can also send something up to the hospital and have it done immediately, so we can get the results pretty quick on most things.
That's awesome, that you can get that done so quickly, that way you can continue on with the care that they need and the prescription they may need, that kind of thing.
Right.
So, do you have any age limitations?
No.
Okay, so you'll take
Anybody.
anybody? Babies?
I take babies.
You take babies. You sound like you like to take babies.
I like babies. Babies are fun.
Yeah, that's great for all those new moms and dads out there that have that new baby, and you know, especially if it's the first one, they're just not sure. Period.
Right.
They're just not sure if something happens with the child and what they should do. So I would be real comfortable if I had a grandchild that I'd bring, hey Denise, fix her, you know.
Yeah, not trying to brag on myself. I think everybody has different things they pride themselves in, but that's one thing I pride myself in. I treat my patients like family, almost all of them. I'm not saying that I'm perfect, but yeah,
some family we're not always thrilled about.
But for the most part, and my patients will hear me say that a lot, if you were my dad, this is what I would do. And, you know, maybe that's not appropriate. I don't know.
Oh,
but
it's very appropriate. That
that's
is
how I feel.
exactly what patients want to heal. They don't want to be a number. I mean, we've already, you know, talked about, like with the insurance, and I'll just say it, insurance companies have basically, we've all started to feel like a number. And have no identity, and it's refreshing to have someone like yourself, Denise, that absolutely wants to take care of the human being, of the person.
Right.
So yeah, it's never inappropriate when you care and show that compassion. It's wonderful. We're missing a lot of that right now in our healthcare fields. So
I agree.
yeah, and we're trying to get it back. There's a whole bunch of us out there saying, "Come on, we can do this." So, which is, I think, where APRNs came from. I mean, I think that's how it evolved.
Absolutely.
There was such a huge need to reach more and more patients. The doctors are on overload,
Right.
and they didn't need to see every patient. You know, so
Right.
there's a huge gap that's been filled with the APRNs coming more and more into play.
I agree.
Yeah, so that's wonderful. It's more than a registered nurse, just a little different than a physician, so it's great.
And, you know, we were talking about that earlier, but there used to be RNPs, you know, this role has evolved over many, many years, but every APRN or nurse practitioner has a master's degree now. Everyone, you know, it didn't always used to be that way, but it is now.
Right. I know it wasn't that many years ago that they went from, let's see, ARN.
APN.
APN.
We were APNs,
APNs
until
right.
about a year ago.
Yes, APNs, and now it's all APRN. So.
And that, you know, that's not just state, that's national, trying to unify the role. There's a big, big push for that right now.
Yeah.
So that's why we changed again to the APRN, so
Which
that we
is
can be unified.
great. That's absolutely what it needs to be across the country. And, you know, I know you're so aware of this, and I'm thinking of the standards that are done in the medical profession, which I always like to get the viewers educated. The fact that, yes, we are in rural mountain home and in the center of the country kind of thing, but the same standards here are being done at Johns Hopkins University.
Right.
Standards are shared, and what that means, correct me, help me here, if something works and they find out what works best for a patient, that information is shared.
Absolutely.
And that becomes a standard that they ask everybody to follow that's in the
Right.
healthcare profession.
Right.
Okay. So, but yeah, so it's APRNs all across the country filling a very, very needed gap that exists. And we're just so glad that that you came today to visit with us. And Kathy, please give us the number again and how people can reach Baxter Regional Family Clinic to get an appointment.
It's 425-6212.
425-6212. Okay. That's the 870 area code, because we serve 14 different counties right here in Mountain Home, which a lot of folks don't realize. I had a question one time from someone that came from a large city that was taking a look at the technology that we have up at the hospital, and they were rather surprised that we had all of this. And I said, well, Mountain Home may be 12,000 plus people, but by serving all these counties, we've got over 100,000 people that we serve each and every year. So we need that equipment. So would you come back and visit with us again?
Maybe.
Now there's an honest answer. Yes, she treats you like family, absolutely, and she's going to give it to you straight, folks. Well, I know, Kathy, I can get Kathy to drag you back one of these days.
You can
So-
get Kathy
All
back,
right.
I'm sure of that.
Well, thank you both for being here today.
Thank
It's real important that we have folks understand what is offered here in our community and part of our Baxter family. So thanks again for being here today. And thank you for joining us for BRMC's Healthy Connections. We will be back with you again next week. Thanks so much.